Hello and welcome to another episode of the program Health Review. I am Chika Onyesi. Thanks for joining us. Glad you could join us again today. Our focus today on the show is on a very silent but widely spread challenge among young Nigerians. I'm talking about illicit drug abuse. Just this past Monday, Nigeria joined the rest of the world to mark the International Day Against Drug Abuse. This problem is rarely given attention in the public health domain, but still it keeps growing. We'll be exploring the issues around drug abuse, how young persons can avoid drugs, and most importantly, the health implications of doing drugs. Please join the conversation on Twitter at Health Review STV and send your contributions to our Facebook page, Health Review on STV. Okay, let's take a quick look at some fact sheets on drug abuse. Over 40% of Nigerian youths engage in substance abuse. Opioids are commonly abused and most harmful. 1 in every 10 young person in Nigeria abuses drugs like codeine, marijuana, painkillers, or antidepressants. Drug abuse is the leading cause of hepatitis C. 1 in 8 persons, that is about 1.6 million people who abuse drugs, also live with HIV. Drug abuse is more common among males at 94.2% than females at 5.8%. Multiple drug use happens nationwide at 7.88% to varying degrees. Okay, that's the fact sheet on drug abuse. For now, we will take a short break. When we return, there is more to come. Don't go anywhere. This is one of the hallways of the National Hospital Abuja. As you can see. Okay, welcome back to the program. Before we continue, I would love to play a short report, a very short report on some private efforts at checking the scourge of drug abuse, especially in northern Nigeria. I'm hoping the report will give you an idea of the depth of the drug challenge in Nigeria. Take a listen.
Experts say drug abuse is now a public health challenge in Nigeria, considering the variety of substances abused and number of deaths recorded. With no accurate data, clinical psychologists say Southern Kaduna, Borno, and Kano have the highest prevalence rates, especially among women. Northern governors' wives are now seeking partnerships to reverse the trend.
The NGWF has decided to fund the Reconnect Helpline, a mental health helpline targeting persons suffering from mental illness and addiction. The helpline will serve as a first point of intervention by providing care, support, professional psychological counseling, information, and direct to mental health services to persons in needs throughout and across the northern Nigeria.
The increase in drug abuse among northern women may not be unconnected with the trauma of insurgency.
NGL needs to be strengthened, not only to enforce drug laws, but to prevent the consumption of illicit drugs. I wish therefore join the federal government to extend the whistleblower policy to curb the menace of drug barons and their carriers.
While many attribute drug abuse to health conditions, the NDLEA warns against the legalization of cannabis.
The people that are dependent on drug, it's not drug use, but the policies that we initiate. Because we must differentiate between the person who is a user and dependent on drug and the criminal. Who gives them the drug? For those who are dependent on drugs, it is a sickness like blood pressure or diabetes, and it is treatable. I want you to know that drug dependency is treatable.
Perhaps the most echoed intervention against drug abuse is the need to break the culture of silence among victims and reinforce the family support system.
There are a lot of deceivers out there who would make you feel it's cool, it's the way of life. You just have to, you just have to go with what's trending. But I tell you guys, it's just time wasting, money wasting. You're going to lose a lot of trust and everything. You're going to lose everything if it's not.
Okay, welcome back to the program. We are still on Health Review, where we discuss critical healthcare challenges in Nigeria. Today, we are focused on illicit drug abuse. Clinical psychologists say drug abuse is now a public health challenge in Nigeria, considering the variety of substances abused and the number of deaths recorded. At the 2017 International Day Against Drug Abuse, the United Nations reminded all countries to honor their commitments to address the scourge of drug abuse. Now, that's a wake-up call for countries who are also not doing anything. And that is why we want to find out Nigeria's status in terms of checking drug abuse. Joining me to do justice to this topic is country representative of the United Nations Office on Drug and Crime, Christina Alberton. Ma'am, you're welcome to the program.
Thank you so
Thanks
much.
for joining us. Yeah, I know you work on the drug control area. Yes, I would like to know, in Nigeria, how bad is the drug abuse problem? Do you have any idea how critical our situation is?
Yeah, I think when we look at the drug use situation in Nigeria, up to now we are relying very much on anecdotal evidence and of course of the testimonies of those who are really concerned, either as users or as family members. But I can also say that we know it is very important to have science-based data, and we are currently supporting the Nigerian government to conduct the ever first household drug use survey in Nigeria. And that survey will tell us which kind of drugs are being used in Nigeria, which are the age ranges, which is the gender of the drug users, which are the amounts that are being consumed over a certain time. And that will give us very, very interesting results and findings, which then policymakers can use to design prevention policies and also the treatment interventions that are required. We are also conducting under the same cooperation project a survey that looks specifically at the problematic drug use. And that means when a person already has such problems that the person is seeking treatment. And that is a community-based survey. So we will have two very important and interesting sets of information that will help the policy makers and the health service providers to tailor the response to it.
Okay, in terms of use and people seeking treatment, would you say that Nigerian policy on drug use and drug abuse has helped, to improve these areas?
Well, I think definitely there are a lot of very interesting initiatives ongoing. I think there's a lot of commitment by the Nigerian government, and I say that against the background that I have worked in other countries.
Yeah.
We have NDLEA that has a very comprehensive mandate to work on this. And the Nigerian government is working also together with us and other partners like the European Union on drug use prevention, on drug use treatment, and also on supply reduction and investigation and prosecution to really bring the drug traffickers also to justice.
Okay, the United Nations is reiterating its call on nations to improve the drug control. I don't know if you have any idea what Nigeria's role is in terms of the United Nations call. Are we participating in what the United Nations wants us to do?
Yeah, I mean, Nigeria is of course part of the United Nations. It's a member state, and Nigeria has also ratified the 3 international drug control conventions, which lay out the action that nations should take to address, to comprehensively address drug control. So Nigeria is a very strong partner in this effort at international level, at global level, and also at national level. As I said, here we have a partnership project between the Nigerian government, the European Union, and UNODC to implement comprehensive drug control in Nigeria, looking at the data collection, the data that we have, that we don't have, the analytical capacity, the criminal justice response to drug trafficking, but also to the health aspect, both including how to promote prevention of drug use and also how to increase the capacities to deal with drug use as was said, as health, under the health angle, treatment, care and rehabilitation of drug users.
Okay, you mentioned earlier a report on the 2017 drug report. But before we get to that report, ma'am, I'd like to find out, there's a report that opium production has increased and that cocaine market is thriving. Now, if we have to control drug abuse, I'm thinking that controlling production of cocaine or cannabis or whatever else people smoke would be the first step towards controlling drug abuse. Don't you think so?
Yeah, actually what experience has shown, and that is already a very, very decade-long experience, is that we have to combine the efforts. We have to combine the supply reduction and the demand reduction. Talking about cocaine and heroin, luckily Nigeria does not produce cocaine or heroin. That comes from different countries, and this is why it's very important also to control the trafficking. But Nigeria has cannabis cultivation, and we are actually also engaged in a survey on how to see what is really the scope of cannabis cultivation, so that then also the government can decide how they are going to reduce the cannabis cultivation. I think supply reduction is very, very important, but I don't think it's the only means that will be able to reduce really also the drug use. I mean, you can control the drug production here in Nigeria, but what happens if the youth goes out? They travel to New York, they travel to London, they travel somewhere else, and they can also use drug there. So experience shows us that we really have to start drug use prevention from a very early stage. We should not only look at drug use prevention at an age when a youth maybe starts to smoke, maybe with 15 years or 12 years, you know, whatever the statistics show us. Actually, the earlier we start with the drug use prevention, the better it is. And I know from other countries that governments have started to introduce drug use prevention already in the curricula of the primary school.
Schools, okay.
And that is probably the most effective way to do.
Yeah, because they start smoking at very young ages. We'll have them at 9, at 8, smoking and doing drugs, going on errands to buy these drugs for the elderly ones, and then sampling whatever it is they've gone to buy.
Exactly.
That's a serious challenge. But first, let's get back to this report, the 2017 drug use report. What exactly is this report telling us differently from what it's been doing 20 years now?
Well, actually, the World Drug Report is now 20 years old.
Okay.
We publish it every year, and it allows us to assess the trends in drug production, drug trafficking, and in drug use. And when we look across the 20 years, if you looked at the data that we had 20 years ago and the data that we have now, you will see a big difference in how drug markets are evolving. And unfortunately, it is like this, that we now have more drugs, a broader variety of drugs, and the markets are expanding. So heroin that you used to find maybe only in Asia and in Europe now also comes to Africa. Cocaine that you only used to find in Latin America, in the US and in Europe, now also reaches West Africa. And wherever you have trafficking routes, you will always find spillover, and drug use will also start. So this report gives us exactly what you were saying. Despite all the efforts that the global community, all the member states of the UN do, the opium markets are thriving, and also the cocaine markets are thriving. We have synthetic drugs. Synthetic drugs can be produced all over the world, also in Nigeria. And there has been a major bust of a synthetic drugs laboratory, I think last year, where it was also found that I think Mexican and Colombian traffickers were involved. So that shows you the international network that is behind it. Then since some years we have the emergence of what we call new psychoactive substances. This is a kind of an alteration of the traditional drugs, but they are not yet under control. So it is very difficult for the law enforcement agencies to control these drugs. But they pose a huge health challenge,
yes.
Because you just imagine you have a young person who experiments, let's say, with cannabis, with alcohol, and then uses another substance that is not yet known. And the youth experiences some problems, you know, like headache or feeling bad or whatever, goes to the doctor, but the doctor does not know what is this, what effects has this drug, how do we treat this drug. The other issue is that we, as I was trying to say, is we very often see polydrug use, that youth do not only smoke cannabis, but they consume a combination of drugs, they mix. So it really becomes a huge, huge issue for those in the health sector who have to deal with it, because we have to develop the services, we have to be able to identify the drugs they take, and then also have the treatment protocol available to effectively treat the symptom.
Okay, we've established that there are health implications of drug abuse. Can you give us an idea of specific areas where drug abuse could affect the health?
Yeah, I mean, drugs, of course, affect the system, they affect the body, they affect the brain. And as you were saying in your introductory remarks, if you look at drug use, if people are really dependent on drug use, they very often also have other problems.
Yeah.
And especially those people who inject drugs. Injecting drug users live very often with HIV. You were mentioning it also. This year we have found out that half of the 12 million people that worldwide inject drugs, they also have hepatitis C. And that is potentially a lethal disease, and it's very difficult to treat it, and it's very costly to treat it. And not to forget that it's very often those who don't have the resources, who are marginalized populations, they will not be able to afford the treatment that you need for these health implications. Very often injecting drug users also suffer from tuberculosis. And if they take too much of the drugs, there is a high risk that they die young from overdose. So really the health implications of drug use can be very, very dramatic.
Okay, I have a challenge where someone says people use drugs because they have a health challenge. Some drugs help you control some medical challenge. I don't know if that's any excuse to use drugs at all. Is that right? That people use drugs to control medical issues?
Yeah, I think you refer to the discussion that is going on regarding the use of cannabis for medical use. And I think it has been proven that there are some medical conditions like multiple sclerosis, even HIV, cancer and so on, where patients say the only pain alleviation that they can obtain is through using cannabis upon prescription. But that should always be in consultation with the doctor, and the doctor gives a prescription and gives the right doses, so that it doesn't come to the effect that we usually see with drug use, that it can lead to dependence.
Now we have a problem. A lot of people are dependent on drugs. Some people realize they have issues and want to seek help, seek treatment. But do you think that Nigeria has that capacity to treat and to, you know, what's that word now? To treat cannabis dependence or drug dependence.
Yeah, no, I think it's a very big issue, and it's not only Nigeria a big issue. I mean, where can people go who need really help? I mean, they have to go to private doctors, to private psychiatrists. I'm not sure if the number of psychiatrists is enough to deal with all these people, and those who cannot afford to go to a private doctor, they have to go to a public hospital. And the public hospitals usually are not prepared for that. So this is why we also have a training programs with 12 hospitals where we train the health workers on how to identify and diagnose drug use disorders, and also how to treat them. And if no medication-based treatment is available, you also always use psychosocial services. So this is something that you can easily provide as training to health service workers. So I think, and then there is also a number of NGOs that also provide services. This is also very important. But the important point is that the training has to be professional, and it has to be science-based. We cannot experiment with drug users.
Okay, what are the signs to show that someone is dependent on drugs? I mean, you realize that Panadol helps you to take back headache, to control your headache, and then each time you have that slight swing, you go to Panadol. Is that also drug abuse? I don't understand that. How do we know when someone is becoming dependent on drugs?
Well, this is a case for a doctor. You know, we have to go to a doctor, and there is a classification by World Health Organization to really, if a doctor diagnoses the patient, only it's the doctor or the psychologist, psychiatrist who can find out if the person is really dependent. It's not that we can just see it. It is like with any other disease. If you have diabetes, you go to the doctor to get the treatment. If you have high blood pressure, you go to the doctor to get treatment, and the same is with drug use. If you have drug use disorders, you go to the doctor to get treatment.
Okay, but how can we determine that one is dependent on cannabis already? People take it, they are social drug users. They only take it when they go on outings. They are not addicted.
It's true. It's true. No, it's very important to make a differentiation between recreational drug use and the drug use disorder. It's not the same. Not a person who once a week goes out and smokes is necessarily dependent. It is usually the patient, the person, him or herself, who will feel some effect and feel, I cannot now anymore without the drug. I need help. And I think a very important principle is treatment in treatment is also the principle of voluntarily seeking treatment.
Help, yeah.
Usually it is not effective if somebody tries to force somebody because I think you are dependent and you should go to the doctor. So I think this is something very important to observe. But of course it is important, it could be important that you have peers. So when we when we try to reach out with services, it is unlikely that a drug user will accept me telling a drug user what to do. So if you have connections with the peers and you can use peers who may have already gone through drug treatment,
yeah.
they can rather, they have better access to the people, reach out and convince them also to maybe join and go to treatment.
Okay, you've worked in the drug area for a while in Nigeria. I'm wondering, what are the treatment options who is dependent right now and seeking help in terms of what the UNODC is doing in Nigeria?
Well, it depends always on the drug. The different drugs need different treatment. There is one size fits all approach. And again, as I said, you have to go to the doctor to find the right treatment. We have, for example, it also depends on the person. We all react differently. It could be that you go with a stomach problem to the doctor and you need a different treatment from a different person. So again, I have to say drug use disorders is something that needs to be treated professionally. We cannot just do it as a lay person.
Okay. Drug use disorders must be treated professionally. Drug use is not something you can handle on your own. So once you begin to you begin to test with weed, what we call weed. You begin to test with marijuana, then you begin to test with cannabis. Realize that you're beginning to be dependent. It's not just about recreation. It is about being dependent on drugs. Okay, we have been talking to Christina Albertine. She is a country representative of the United Nations on Drugs and Crime, United Nations Office on Drugs and Crime. Okay, we are still on Health Review. Let's take a short break. When we return, we'll sign out. Okay, we have been speaking with Christina Albertine. She is the country representative of the United Nations Office on Drugs and Crime. Thank you, ma'am, for being on the show today. We hope you oblige us next time we call on you to be on the show. Thank you very much. Okay, you've been watching Health Review on STV. It's now time to bring you our healthy living tips. But first, send your contributions to our Facebook page, Health Review on STV, and our Twitter handle, Health Review on STV. On behalf of the production crew, thanks for being part of the show. And please, don't do drugs. Bye-bye.